1,573 newly confirmed cases and 25,146 asymptomatic cases added. Among the 2,573 confirmed cases, 2,200 were identified in the controlled areas. The remaining were identified in NAT, and 114 of them have been converted from previously asymptomatic cases. Within the asymptomatic cases, 24,548 were identified in closed-off controlled areas. 598 were identified through massive testing. The 2,573 newly added confirmed cases are from 1,300 in Pudong and 27 Pudong, Songjiang 131, Huangkou District 127, Changling District 105, and Qingpu District 99, Yangpu District 59, and Jiading 54, Jing'an 49, Putuo 45, Baoshan 13, and Jinshan 12 cases, Chongling 7, and Fengxian 2 cases. Based on their nucleic acid test, medical diagnosis, and medical imagery, the above-mentioned 2,573 have been officially identified as newly confirmed cases. There are 25,146 who have shown a positive result of nucleic acid testing, and they have been categorized as asymptomatic cases. As of yesterday, we have traced 280,000 people with close contacts, and they have been placed under control. Among that, 230,000 of them have a negative result of nucleic acid testing. We are currently screening the remaining part of that population. And we have also traced more than 120,000 people with secondary close contact. Most of them have shown a negative result, and we are screening the remaining part of the population. We have discharged 737 confirmed patients yesterday from hospital, and they will return to their apartment and go through a process of medical observation. In recent days, there is an uptick in the number of people released from hospital, and different jurisdictions must do a good job of handover. And we also advise those dismissed from hospital to carefully observe the rule of a 7-day medical observation at their homes. Thank you very much to Madam Wu Qianyu. Now the floor is open for questions. And before raising the question, please also identify yourself. Line number 16, please. Thank you very much. I'm with News Morning. So my question is that the neighborhoods, they have been in lockdown for quite a number of days, and why we're still having positive cases? Thank you very much for your question. And there is a lot of us asking this question, and according to our analysis, there can be the following reasons. Number one, there is a backlog or delay of the result reporting of the nucleic acid test. If we have identified a tube with a positive case, then we have to conduct another round of the NAT, and we also need to conduct epidemiological survey around the confirmed positive cases, and we have to collect their personal information and their whereabouts, and we have to submit this information and also verify such information. Secondly, there is this cluster infection within families. As you know, that the subvariant of Omicron, BA2, is the dominant variant of this wave, and this is highly a coverted variant, and it's quite infectious. And we have a incubation period of 3 to 5 days, and so cluster infection within families is the major form of this round of infection. Normally, when there is one confirmed case within that family, most likely the remaining members of the family would also be infected, but they will only show a positive result after a few days. And thirdly, because we are practicing closed-off management citywide, our residents are staying indoors, but the logistics is going on. We have food and other items delivered to the doorsteps, and those may contain some positive virus. Next question, please. Line number 5. Thank you very much. I'm with CMG. My question is to the Shanghai Municipal Health Commission. We noticed that yesterday there were some severe cases, and can you give us an update about their current situation? Thank you. Thank you very much for your question, and this is a question of big concern. In Shanghai, we have a lot of confirmed cases. Apart from the asymptomatic cases, within the confirmed cases, most of them are having mild and light symptoms, but we do have a couple of severe cases. We have 9 of them currently, and they are being treated at designated hospitals. Among these 9 severe cases, we have 7 males and 2 females. 1 patient is at the age of 33. The other 8 patients, they are senior citizens, aged between 70 and 93. They have some pre-existing conditions before that. For example, they have some immune system disorder, late-stage cancer. They also have some very severe cardiovascular disease, and they are having decaying organs. Also, some cases, they are at a very senior age, and also they have not been vaccinated against the virus. We are currently following the 9th edition of National COVID-19 Treatment Protocol. Each patient is given a special treatment plan. We are currently pulling together doctors from different disciplines. In particular, for those severe cases, they have some pre-existing conditions, as I have just mentioned. So, on the basis of treating their pre-existing health issues, we also have to step up the treatment on COVID-19. So we are doing a lot of things at the same time. In the meantime, we have to guard against potential side symptoms and other infections, and we have to also support the recovery of their organ functions. We are combining Chinese medicine with Western medicine. We are following their health status very closely and trying our very best to recover all of them. As we are having an increasing number of confirmed cases, a lot of them are at a senior age, and the number of severe cases is also on the rise. We have put together fine medical resources of the city. For example, in the northern zone of Regional Hospital and also Shanghai People's Hospital, we are pulling together all those medical resources while treating COVID-19. We are also addressing the pre-existing diseases of those patients. Thank you. Thank you very much. Next question, please. Line number 13. Thank you very much. With the Shanghai People's Broadcasting Station, after we lift the ban, people worried that with the increasing flow of people, there might be an increasing risk of infection. So what is the risk that you can expect in Jing'an District? Thank you very much. The Zhuji town is a very old town in Shanghai. It has some rural population and also some urban population. And it has also multiple transportation routes. Zhejiang County has 9 closed-off areas, 9 controlled areas, and 93 precautionary areas. And we have the most precautionary area, and that is giving us a lot of worries in terms of people flow management. So we have worked out some rules. We put management and control in the first place. We can make sure that the lifting of the bans is conducted in an orderly fashion. We have worked out 3 lists covering villages, supermarkets, and residential communities. And currently, we have opened Dama supermarkets, infantry shops, and also some schools. We are continuing with the road traffic controls, and we only allow free flow of people within the closed-off area. And we have 24-hour patrol, key passages with our guards. We are strengthening the control of orderly flow of people. We look at where people are going and where they are traveling from. Each day at different hours, we allow only 1 person out of 1 family to be able to travel to other places. And we give people pass certificates with which that they can travel in and out between the village. We also designed a control map that includes a supermarket, a business center, so that we can channel people to purchase goods from those grocery stores in an orderly fashion. And we also encourage the public to preserve the purchases in advance online. And we ask people to stand in the queue, maintain social distancing, and after outdoor activities, we would put in place disinfection. And whenever we identify a positive case, we will immediately initiate a set of processes. And for those at the closed-off area, people still have to stay indoors. We are still having those very strict measures. We have piloted a new mechanism featuring better grassroots level controls, and for every building there is a grassroots cadre, and for every residential community there is 1 chief who is managing the WeChat group, addressing the concerns of all those residents. For every village, there is also a COVID-19 manager focusing on the concerns of key populations, answering the calls of all the villagers. And also, at each village, we have a delivery team so that the villagers they can place orders online, and the order will be handled at the village level so that they can place orders on other platforms and then deliver the items or medicine or drugs to the villagers. Right now, each and every day, we are tackling the drug needs of 100 villagers. All right, next question, please. Line number 17. Thank you very much. And with the paper, we have a lot of newly confirmed cases every day. Are we still conducting epidemiological surveys, and what is the key focus of this activity at present? Thank you very much for your question. Right now, we're having a very challenging and complicated situation in Shanghai. Epidemiological survey is a crucial part of our work. We have to conduct an epidemiological survey for every confirmed case. Right now, the focus is on core information. Through serving of key information, we extend that to related persons, potential exposure risks so that we can trace the source of the infection. In the meantime, we have to quickly trace those with close contact with the confirmed person. In the meantime, we are stepping up our effort in factories, in companies, and also in some construction sites, because those places are those with frequent flow of people, and it's quite likely that there are some exposures of COVID-19. So whenever we identify a positive case, we would conduct a epidemiological survey. Right now, apart from tracing the source and tracing people with close contact, and also apart from cutting off the spread at the community level, each and every day, we are collecting the epidemiological survey information, we are categorizing those information, analyzing the information so that we know when and where those confirmed cases got infected, so that we can understand the trend of the infection. In the meantime, we know where the risk points are, so that we know how to immediately cut off the spread of the disease. And this is crucial to the subsequent adjustment of our COVID-19 measures. Here, I would like to thank our residents in Shanghai for their staunch support and understanding of our epidemiological survey work. Thank you very much. This is all for today's press release. Should you have any further questions, you can get in contact with the Municipal Information Office or the Shanghai Municipal Health Commission. And we will keep you posted if there is any update. Thank you.